Okay, welcome. This is Islam Gaudat. As I told you, we will start the calculation sessions. It's mainly divided into two parts. The first one, which is related to the pharmacokinetics. It will take about 3 sessions. Then the pharmaceutical calculation also will take about 3 sessions. We will discuss the most important topics, and also we will see how to solve the questions in the exams. Also, the simple and complicated calculation considered to be a very important topic in the Kaps. As in paper 2, you will have mostly 12 to 15 calculation question, which is considered to be 15% of the paper 2 mark. So it's very important to solve all of them accurately. Mostly you will find 10 of them is very easy, direct. You will not take any time to solve it. However, there is two complicated questions, which are just will consume some time, not too much, but I will also give you the way how to solve it. It's also divided to two parts. One of them, half of them kinetics part and half of them related to the pharmaceutics part. So calculation is the key of success for paper 2 mainly, and for each branch in the therapeutics part and the pharmaceutics part. Then we will start. First of all, we will have here some of the important pharmacokinetics principles. Okay, first we have the zero order reaction and the first order reaction. Mainly, I discuss both of them at the same time so you can have clear view of both of them and you can differentiate each of them easily. Here, the zero order. You are following? Is it clear for you till now? If there is any problem till now? You can write, please, for me. If there is any problem, you can say. If it sounds not clear, you can say. Yes, okay. Okay. Here, this one is the zero order, the curve for the zero order. Let's look like this. The first order, most of our equations and most of our calculation will be the first order. However, we have to differentiate between both of them. Here in the horizontal axis, we have always the time. The vertical axis, we have the concentration. Here, as we see the slope, this is called the slope. And the point where the slope and the vertical axis is called the intercept. Here we have the value of C node, which is considered to be the initial concentration of the drug, C node, okay, or C0. just a second. Okay, now we will go for the equation of each of them. For the first order kinetics, the equation is log C 0 equal to log concentration minus KT divided by 2.3. Okay, however, here we have C naught equal to C minus KT. This is the equation of both of them. Here, as I told you, the initial drug concentration. Here, the concentration at a given time, which is this one. Okay, and K represent the rate of elimination reaction. Okay, so those are the two main kinetics type of reaction we will deal with, and those are the equation for it. Okay, sorry, here, just here C and here C note, and here, sorry, C. Okay. Uh, the as I told you here, if you want the deconcentration at a given time, so this is the equivalent. After that, I will show you how to calculate it. Okay, the second important information here is that the zero order reaction is concentration independent, while the first order concentration is concentration dependent. What is the meaning? That we have here the rate of reaction is depend on the concentration, and in the zero order reaction it does not depend on the concentration. So we will have to take an example so it would be easy for us. We have here a concentration of 100 and a concentration of 200, for example. Okay, so in the first example, we have a concentration of 100 after a specific time, which is called T half-life. We will explain this in details after that. It will be 50. After a specific half-life, it will be 25. However, the same medication we have, after a specific half-life, it will be 100. Another period of time, it will be 50. So here the amount, okay, eliminated is not the here the amount is eliminated is different. Here the amount of eliminated is 50 milligram. Here the amount eliminated in the second example is 100 milligram. So the amount eliminated in this reaction depend on the concentration you start with. Here we start with 100, the eliminated amount is 50. However, here we have started with 200, the eliminated amount is 100. We will go to the other side where the zero order reaction. We will give the two examples of the same 100 and 200. Here, there is fixed amount is eliminated per unit time. So, for example, for this medication, the amount removed is 30 grams, for example. Here we have 100 gram. After specific time, it will be 70. After also the same period of time, it will be 40 because the amount is 30 grams. We have here 200. The amount eliminated is 30, so it will be 170 gram. Then after a specific amount of time, it will be 140. So the amount eliminated for this the zero order reaction is not dependent on the concentration. It is not dependent on the concentration. So it is concentration independent. By the way, this is an exam question. You will find that one of the, also on recalls, one of the exam questions, the zero order reaction is concentration dependent, concentration independent in the choices. You would choose the concentration independent. Why it is concentration independent? Because the amount eliminated does not depend on the concentration, the initial concentration of the drug. It's fixed amount. It has no relation with the concentration of the drug. So now this is the first equation. We will solve with it some questions after that. Okay, this one is very important. We will add here all the important questions, all the important equations we will use to solve the questions. Okay, so this is the first one. Then we'll go for, this is the first one, first important equation we will solve question with. Then we will go for the concept of half-life. This is also an exam questions. This is an exam question, as I told you, the T half. What does it mean? The T half, its definition is the time required to reach a half concentration of the drug. The time required to reach half drug concentration. Okay. Till now, is it clear? All following? If there is any problem? Okay. So, uh, this is the half-life. This is a very important concept, very important tool to solve the question. We have here a major equation that T half will equal to 0.69 divided by K, which is the elimination rate constant. So whenever you see T half, you can get the K, and whenever you see K, which is the elimination rate constant, in any question, you can get easily the T half. Okay, so this is the second major equation that we will use to solve questions after that. So we will add it here in our rules. So now we have three major question types in the Kaps exam and in the pharmacokinetics part. Okay, the first one, the second one, the third one. The first one, which is IV infusion type of questions. The second one is, sorry, this one IV bolus injection. The second one is intravenous infusion, and the third one, which is the oral. Okay, so here the equation for the IV infusion. This is very important and very easy. They are all related. If you study each of them separately, you will find some difficulties in differentiating and you will get confused in the equation of each one. However, this method is very good and you can remember with it all of the equations that you will need to solve the question without exerting a lot of effort. We have here the concentration equal concentration of drug in the blood equals to the dose divided by the volume of distribution. Volume of distribution. Okay, so here the first concept we have is the concentration in the blood, which is given in milligram per liter or nanogram per milliliter, whatever. Then we have the dose, which is the IV given dose. It's mainly in milligram, and we have the volume of distribution. The volume of distribution is the area that the medication is distributed to. By the way, this one, the volume of distribution have four major uh, sorry, just a second. The volume, yes, the volume of distribution have four has four major categories in have four indications for its values. Sorry. So the first one, second one, third one, and the fourth one. Okay, if you find that the volume of distribution value is 3, this means that the medication is attached to the plasma only. If you find it a value of 6, so this means that the medication has high blood binding. If you find that the value is 14, that this means that the medication is bind to body organs, and if you find it 25, this means it is binded to tissues. Meaning, for example, if we have a medication that has 3 liter, this means that it's binded to the plasma. 6 liters, it is binded to the blood. 14 liters, it's binded to the organ. Meaning, if you have a medication that is binded to the muscles or the bones, okay, so this is attached to the it will has a volume of distribution of 14. Tissue, adipose tissue, that the drug has some lipid solubility, that is, it will be distributed all over the tissue, the adipose tissue, so it will give you the value of 25 liters. Okay, this is the first some of the indications of the volume of distribution. Then now we will go for the intravenous infusion equations. Instead of, we'll see the same equation here. The same equation, we have C equal to D and VD. Here, D and here VD, volume of distribution. Now, as we have, this is the same equation, no difference. If you can see here, there is no difference at all. Then it's infusion, so it will be plasma steady state, CSS, okay, will equal to loading dose divided by VD. So now it's easy. This is the main difference. That's it. The same equation as the intravenous bolus injection, just add CSS, and beside the D you will add a loading dose. That's it. So what is the meaning of IV bolus injection? IV bolus injection, that you have a syringe containing the medication and you directly inject it into the vein of the patient, and that's it. This is the bolus injection. Okay. What is the meaning of intravenous infusion? We have infusion set, that is, give drops each unit time to the patient, delivering it to a high period of time. So we have here, we will leave the oral for a second. Now we will go for the curve of the intravenous infusion, then we will go for the curve for the intravenous injection. First one for the intravenous infusion. This is for IV bolus. Then the second one is for the intravenous infusion. So studying by comparison, it will give you a holistic view for the topic and you will not forget easily. Then the intravenous injection, the curve, it will look like this. This is the intravenous injection. The intravenous infusion, it will look like this. Okay, here time, as we always said, here the concentration. Okay, now what is the aim for getting the intravenous infusion, which is we do this type of dose administration to get a steady state constant drug concentration in the blood for a long period of time. Okay, this is the main goal for the intravenous infusion. Okay, so here, what is the time required, exam question, time required to reach steady state. You will always find it in the recalls. It is from 4 to 5 T half-life. Okay, from 4 to 5 half-life. So we will add it like this: 0.5 T half-life. 0.5 half-life. This is the time required to reach this state. What happens in the steady state concentration? In the steady state concentration, we have the rate of infusion equal to the rate of elimination. The rate of infusion of the medication in the blood is equal to the rate of elimination. So as the rate of input equals to the rate of output, you will get this flat line, stable plasma drug concentration. Okay, from the definition I have told you, we have the other important equation for the steady state concentration, which equals to the rate of infusion divided by the clearance, which is the rate of elimination. Okay, this is the second important equation for determining the steady state concentration of the blood of the medication in the blood. Okay, so till now, anyone has a question? Do I have to repeat any point? Okay, okay. So now the question is, what is 0.5 T half? As I told you here, we have, this is a concentration. To reach this concentration, we need time. So we need to estimate the time to reach the steady state concentration. So how can we calculate the time required to reach steady state concentration with this equation, which is 4.5 half-life. This is, for example, if I have a medication that I give as an intravenous infusion, what is the time required to reach the steady state concentration if the half-life of this medication is 10 hours? When I could reach this shape of curve in the blood if the medication has a half-life of 10 hours. By using this equation, this will give me the answer, which is 45 hours to reach the steady state plasma concentration. Okay, there will be some example in the future. I will show you how to solve some questions. Then we can continue. Okay, Daisy, okay. Train, okay, good. So it is only the time required to reach steady state concentration. So now we will collect all the important equations we will use here. We will take this one also. Time to reach steady state concentration. Also here we will take this one. The rate of elimination equals rate of infusion, sorry, divided by the clearance. And also the one we have is loading dose divided by VD. Those are some of the important VD. Okay, so now we will go for the next part of this session, which how to implement those questions, those laws in solving the questions. Okay, it will be very easy, very simple for you. Now we will take those equations into practice. Okay, now we have collected all the information. We have given an overview of each of type. The oral medication will be discussed later. Now we will go for the first question, how to solve questions. Please, if you have uh, your comprehensive pharmacy review book, do you have it with you? Great, that's good. Yes, the CPR. Good. Now we will open page 116, question number from 2 to 5. Great. Now we will start. First of all, as a general rule, before solving any question, we will have to do two things. Before solving any question, you will have to unite your units. Unite the units. Then the second one, which is that you get final value, of each component of question. How? We will see. For question number 2, a new cephalosporin antibiotic was given at a dose. Dose, this is the first question we have. A dose of 5 milligram per kg. This is the first one, first information. Then, as a single intravenous bolus injection, so this question is related to the intravenous bolus injection. 2-year-old man who the weight is important, equals to 75 kg. Follow one compartment model. The elimination half-life is very important. Half-life equals to 2 hours. Then the volume of distribution equals to 0.0 liter per kg. Then, what is the initial plasma concentration for this patient? So here, as I told you, before we start solving any question, we will have to unite the units. What is the meaning of unite the units? If I have here, for example, a milligram and another concentration in the same question containing grams, we will either convert all of them to milligrams or all of them to grams. This is the first rule. Okay. The second one is to get the final value of the component. Okay, final value of the of each amount. Here, the dose is 5 milligram per kilogram. This is not the final dose amount. Okay, so the dose here is known to be with milligram only, or grams only, or nanograms only, or microgram only. So here, to get the final total dose, we will multiply 5 per kg, the weight for patient, which is 75. Now we will have the final dose for the patient, the total dose for the patient. Okay, 5 multiply 75 will give 375 milligrams. So the final 375 milligram, this is the total dose. If you find in the exam that he gives you a dose in 10 milligram, so this is the final dose. If per kg, you will have to multiply it with the weight of the patient, so you will get the dose that you will use it to solve the question. This is the first step. Is it clear? So we can proceed. A train. Great. Now, also we have here another value that yet to be determined, which is the volume of distribution. We know that the volume distribution unit is in liter, not per kg. So we will do the same with the volume of distribution, so we can get the value of volume of distribution that is going to be used in the question. Volume of distribution, here the weight, multiply the weight, which is 75, we will get the amount of 21. 21 liters is the volume of the distribution. So now we will remove this one and we will write 21. We will remove this one and we will add 375 and here liter. That's it. Now we have the total value of each dose and volume of distribution, the final one, which can be used. There is no need to unite any units because there is no major difference. They are all the same. Then we will go and proceed for the question. What is the initial plasma concentration? Now we will see here for intravenous bolus injection. This is the equation we will use. So it will be like this. The equation C will equal D, which is the dose multiply the volume of distribution. It's very direct and easy. 370 divided by 21 will give me 17.5 17.8 equal 17.8. Okay, so this is the first one. This is very simple and easy. 17.8. So it will be the answer is C. The answer is C. This is very simple, as I told you, and easy. Is it clear if there is any problem here? Great. Then we will go for the next question. The first one, the initial plasma concentration. The second question here is what is the predicted plasma drug concentration at 8 hours after the dose? So here what is the question is what is the predicted plasma concentration? The question number 3, what is the predicted plasma concentration after 8 hours? So here we after 8 hours. After 8 hours. Then uh, in this type of question, we have two approaches to solve the question. The first one, which is long one, which is log C equals to log C node minus KT divided by 2.3. This is the first approach. Here, the concentration, here the initial drug concentration, which is this value, the K, we will have to determine it, T, which is 8 hours, and this is a constant value, so it can be solved easily. We have all the required information. Or the simple one, which I will show you now. The concentration of the medication initial one in the blood is 17.8. Okay, so after a specific unit, after a specific half-life, which is 2 hours, the drug will reach its half plasma concentration. So this 17.8, you can divide it easily by 2. It will give you 8.9. Okay, so this is after 2 hours here. We have here 2 hours. We have here 2 hours. Then 2 hours. Then another 2 hours. Just follow and you will see how it is how easy it is. Then we will divide again by 2, 4.4, 4.4, then it will be 2.2, then it will be 1.1. So if you calculate it, if you calculate all those periods, 2, 2, 2, it will give me 8 hours. Okay, so the time, the concentration after 8 hours, it will be 1.1 without using this complicated question, this complicated equation. Okay, so this is the approach that is used normally in the exam. You just here add the period of time that is a half-life, then you divide the concentration by 2 multiple times till you get the concentration you require. Okay, now is it clear? This type of question is it clear for you? Yes. Train, Amr, and Nordit. Great. So we will go for the other question, other approach, just to show you how it is easy and simple and time saving to use this method. Okay. But first here we need to determine the value of K, which is the elimination rate constant. As I told you before, if you need to determine the elimination rate constant, which is K, the direct indication of it is the half-life. If you need to determine the half-life, you will certainly need the elimination because we will use simply this equation, this one. That's it here. So here to determine the value of K, it will equal to 0.69 divided by 2, it will give 0.69 divided by 2, it will give 0.34. 0.34. Okay, now this is the concentration needed, so we will not do anything here. The log 17.8 minus K here 0.34 multiply the T, which is 8 divided by 2.3. Okay, we will see this one now. 0.34 multiply 8 divided by 2.3 will equal to 1.18. I need 1.18, and the also I'm calculating the value of log 17.8. 1.25. Okay, so now we have here 1.25 minus 1.18, it will equal to 0.7. Okay, so here we have 0.7. Okay, so now we will get the this is the value of log C. So shift log, you will find it on your calculator as like this. Sorry, 10 to the power of x. Okay, so now we will try it. It will be 0.07 it will give me 1.17. So this is the same equation, give me 1.17 as a plasma concentration after 8 hours. This is very complex. The using of the half-life method, as you see here, is time saving, accurate, and very simple. Okay, so all you have is to write the concentration, then you start going for periods of half-life, then you count the total period of time required to reach this certain concentration, which is 1.5. Okay, so in this case, we have consumed 8 hours to reach this concentration. So the answer here is P, and it's very easy. Okay, till now, there is any questions? Great. Okay. Now we will go for the next one, which is number 4. How much drug remains in the body? How much drug remain in the patient body after 8 hours? Okay. Okay. So now, how much drug, not a concentration. Now he asks about the amount of drug remain in the body after 8 hours. We will go for the previous question. For any question, just imagine the equation for it. C equals D divided by VD. Now he asks about a drug, amount of drug inside the body. I have the volume of distribution. I have the concentration already. I have calculated in the previous question. So this is the first approach, which is, as I told you, we have two approaches. Now I know the concentration already from the previous question. So here the dose equal to concentration multiply the volume of distribution. I already know the concentration, which is 1.117, multiply the volume of distribution, which is 21 here. It will equal to 1.117, 21, it will be 24.5. 24.5. This is the first one. When you look the choices, you will choose the nearest one. Here we have, which is number P also. Okay. The question number 5 is P. Now, the other approach, the same one, the same half-life we have used before. We in the first approach we have considered that we have the concentration already, and then we multiply it with the volume of distribution according to the equation, and we get the amount. However, here we will suppose that we do not know the initial drug concentration, which is also very easy method to use. The amount in the body after 8 hours. I have The initial concentration, the initial dose in the body is 375. So we will use this approach. 375. After one period of t half, then you will open your calculator. You will start dividing by 2. By 2, it will equal to here 187.5. Then we'll go for another period. 93.75. We'll go for another period. It will give 46.8. 46.8. Another period of time, 23.4. So here it will be 23.4. So the periods is here 2 hours, 2 hours, 2 hours, 2 hours, total of 8 hours. We have this concentration, this dose, sorry. This is the amount in the body, the amount of medication in the body is 23.5, which is after 8 hours the right dose. Okay, now is it clear? Same as concentration. If he asks about concentration, we'll start with the initial concentration. If he asks about the dose, we write the dose. Okay. Certainly you use the half-life method. It's time saving, especially in part 2, which is very time consuming. So save your time for revision, for solving any question, for flagged questions. So use the shorter one, which is this one, the half-life method. Okay. Yes, it will work with you. Okay, I will give you an example now. If I ask you what is the dose, what is the amount of medication in the body after 10 hours? Now you, please, you can write your answers. After 10 hours, the answer, the amount of medication in the body will equal to. Yes, excellent. That's it. Okay. So if I ask you, yes, great. That's it. If I ask you what is the concentration of the medication in the body after 10 hours, it will equal to, from the previous question, yes, that's correct. This is the right answer. So that's it. Yes, train. I'm asking them, I need the concentration after 10 hours and the amount of drug after 10 hours in the blood, in the body. The amount of drug in the body after 10 hours, the amount of the concentration after 10 hours. That's it. We have here stopped at 8. You can answer, please. before we can proceed? Okay, okay. Train, is it clear for you? The calculating the amount inside the body and the concentration inside the body after a specific unit of time, that's good. So we will move for the question number 5 here, how to solve it. In the exam also, he may ask you after what is the amount of medication inside the body after 2 half-life, after 3 hours, after 6 hours, according to the half-life, you can manage it. Yes, the 117, I do not understand. Okay. Uh, the same here. We started with the initial plasma concentration. Okay. Then we will go for half-life, series of periods of half-life, till we reach the certain needed time, which is 8 hours. We get the 117. Or you can go for the long method, which is the log method, which is this one, which is, as I told you, time consuming. Okay, you can see it in the record. If you did not get it, I will explain it for you again. Okay, now we will go for the question number 5, which is how long after the dose is exactly 70% of the drug eliminated from the body. So beware that this is an exam question. 100% it will come. Sure, it's not the same numbers, but it is the same idea, it is repeated. He speaks now percentage. How long after the dose is exactly 75% of the drug eliminated? So, we speak percentage also. So we will start with 100%, because this is the truth. We have 100% of the drug inside the body. Now, after half-life eliminates half the amount that is already existed. So we have 100, it will be after one half-life is 50, after another half-life it will be 25, after another half-life it will be 12.50. So now I have those values. Now, how long after the dose is exactly 75% eliminated? I have here, this is the amount remaining in the body. This is the remaining in the body. So the amount eliminated here, we will have a parallel view of this values. You can hear me? You can hear me? Okay. Amr, the sound is good. Again, I will repeat this. He asks about the how long will it take to eliminate 70% of the medication out of the body. Now I have 100%. After one half-life, it will be 50. After one half-life, it will be 25. After another half-life, it will be 12.50. This is the remaining values. Now I have a parallel view of the same values. I have 100 in the body, so it will be 0% out of the body. If I have 50% in the body, so I will have 50% out of the body. Now, if I have 20% in the body, so I will have 70% out of the body. And if I have 1250 in the body, I will have also 82.50 out of the body. So now I get the value I need. I have the first, I will write here, this is the eliminated amount. Okay, those are the eliminated values. Now I get my value. This is the one he's asking about, which is 75%. It comes after 2 periods of half-life. Each is 2 hours. So I have a total of 4 hours. The answer is number P. So this is how it's calculated. Is it clear? Okay. So in this particular part, it is an exam question, as I told you. It is an exam question. However, in the you will have to pay attention to the question itself because there is some manipulation of the language. Sometimes he asks the remaining amount, okay? Sometimes asks about the eliminated amount. So you will have to beware of the amount that is needed. Is it the we discuss the questions from the Comprehensive Pharmacy Review book. Okay. This is chapter number 5. So now, as I told you, you will have to concentrate on the questions, on the question itself. Is it amount remain or amount eliminated? Okay, because 100% you will face this question in the exam. Okay, now we still have some time to go for some questions of the intravenous infusion. Okay, we still have, I think we will delay this. I will have to explain a point here, which is the, it's also related to the rate of infusion. As I told you, we have two equations, CSS equal to loading dose divided by the volume of distribution. And the next one, which is based on the definition, which is the rate of infusion equals to rate of elimination. So we have here the rate of infusion divided by the rate of clearance. So now we have a concept here we have to speak about, which is the clearance. The next time we will solve the questions of steady state concentration, all of them, the questions of clearance and the oral drug medication. The last question, the last session for the pharmacokinetics, we will discuss the bioavailability, we will discuss the shelf life, we will discuss the concept of the pH and pKa, all of those types of equations, the hepatic clearance, all of those. Okay, now we are speaking about the clearance now. What is the clearance? The clearance is the rate of that is the medication removed out of the body. Okay, it has an equation. So what is the equation for the clearance? Clearance equal to K elimination rate constant multiply the volume of distribution. This is the equation for the K. As I told you before, the K is a direct indication of T half, and the half-life also is a direct indication of the K. As you have half-life, you can get the K and vice versa. Okay, now the elimination of inside the body, we have another equation, which is the clearance, total clearance. We all know that there is many routes of elimination of the medication. The first one is the hepatic, the second one is the renal. Those are the two main elimination routes in the body. We have also the skin by sweat, also by breath in the lung. There is also feces you have considered to be one type of the excretion of medications. However, those all considered to be minor way of elimination of the drug outside of the body. We have only the two main that are calculated, and we concentrate on them. The first one, which is the hepatic, the second one, which is renal. So here the clearance hepatic plus the clearance of the renal clearance. Okay, so this is also an important equation. Plus, we have another equation which is specific for the hepatic clearance. We have the hepatic clearance equal to Q, which is the amount of blood introduced to the liver, multiply the concentration of the drug in the artery minus the concentration of the drug in the vein divided by the concentration of the drug in the artery. This is called the extraction ratio. Simply, why this considered to be the hepatic clearance? I will show you so you cannot and you will not forget. This is the liver. We have here the vein, the artery, and we have here the vein. So we have here introduced amount of blood containing a certain amount of medication, which is concentration of the drug in the artery. Then we have the concentration of the drug in the vein. So if you minus this value, the first value from the second value will give you for sure the amount that the liver eliminated, the amount the liver cleared from the blood. So this is called the extraction ratio. So that's it. It's very simple and very easy, so you cannot and you will not forget. Why those two values specifically? Because this is the amount that the liver removed from the artery, and it's multiplied with the Q, which is the blood flow to the liver, and it gives us the hepatic clearance. Okay, so as I told you now, we have those values for the steady state concentration. We have known that the steady state concentration is reached after 4.5 half-life, and as the clearance appeared in this one of the equations here for the steady state, we have explained the equation for the clearance, which is equals to elimination rate constant multiply the volume of distribution. Next session, inshallah, we will discuss in details how to solve all of these questions. All of these questions is an exam question. Q is the hepatic blood flow. Okay, the amount of blood introduced to the liver per unit time. We will solve the questions for it the next session. We will also solve all the ideas that is related and non-related to the Kaps exam for the concentration for the intravenous infusion questions in details. That's it for today. I wish it was a good session. I wish it is informative. I wish you get all the information you need. I wish also it was clear for you. That's it. If you have any question, you can send it to me. This is the end of. I wish so that makes things clear. Next session will have more and more important question. The next session will be tomorrow, inshallah, at the same time. Also, if you can come live, it will be good. It will also be recorded. It will be on the group. That's it. Wish you all the best and see you tomorrow. Goodbye.